Hi, I'm Dr. Jha from Renew's Clinic in Leamington Spa. Today I'm meeting this young gentleman who had laser mole removal just a few weeks ago. Mole is a common problem. Everybody has mole. More you expose yourself in sun or more outdoor activities, you will get more moles, especially in fairer skin individuals. Generally, one should not worry about moles, but if you have concerns about any moles, of course, we advise you to seek your help of your own doctor or GP. In general, mole do not produce any symptoms, but if they are producing any symptom, that is a matter of concern. Symptoms it can produce pain, itching, oozing, bleeding, any symptoms. And if the mole is producing any of these symptoms, you must immediately or as soon as possible seek the help of your expert doctor. At Renew Clinic, we do offer mole checks and so on, but most mole that we come across or see, like Andrew had, did not produce any symptoms. Now, these moles which did not produce any symptoms, we as an expert, we look at these moles in a different way. And there's a set criteria for this, and that criteria popularly known as A, B, C, D, E criteria, and we look at individual moles and see. A stands for asymmetry. Is the mole symmetrical or asymmetrical? If the mole is asymmetrical, that demands it to be removed and sent for histopathology or biopsy as you call. B stands for border. How the border of the individual mole is. Is it smooth and rounded all the way through, or has it got some irregularity on the border? That's B. C stands for color. What is the color of the mole? And is it uniformly same color all the way through, center, periphery, everything same color? Then that's fine. But if there is a patchy different colors, or two colors or more than two colors, these moles can be suspicious and they need to be removed and sent for histopathology. That is C. D stands for diameter. Diameter means what is the size of the mole. Generally, if you pick up a pencil, end of a pencil, that equals or measures about 5 millimeter size. Now, are you able to cover that particular mole with the end of a pencil? If the answer is yes, then you can leave it. If the answer is no, you can't cover it, then I would suggest that you must seek the help of your doctor to consider it to be removed and biopsied. And that is D. E stands for evolution or age. What is the age of the mole? If somebody walks into my office saying that, Dr. Jha, I've noticed this mole only 3 weeks ago, I start worrying. Such a short history of a mole present in the body is worrisome. And therefore you should seek help of a doctor, or you come to us for assessment. That summarizes the mole assessment. Now coming back to Andrew, I had a look at Andrew's mole when he came a few weeks ago, and these were completely harmless, but of course he was concerned because he didn't like the way it looked, or quite, isn't it?
Yeah, I just didn't like the size of them, the positioning of them. One was slightly raised, so I sought your advice on getting them removed.
Yes, so we did your mole under local anesthetic, where we give you tiny bit of injections on both sides, and we then removed it with the laser. And it's nearly 5 weeks since we did it, isn't it?
Probably just under 5 weeks, but as you can see, there's no marks to see. It was pain-free, quick and easy procedure. A little bit itchy afterwards, and that was...
How much do you think has made a scar, if at all?
It's ever so slightly pink. To a trained eye, you could probably see that was something there, but no one else has even noticed it.
Yeah, I mean, with laser, you don't get any scar. That's the beauty of the laser. Of course, the procedure is expensive. If you are looking for a laser mole removal on your body or trunk, then you're looking at a cost of about 150 to 200 pounds each. But if you got some mole on your face and you got a cosmetic concern, that price may go a little bit up to 300 to 400 pounds, depending on how big they are and so on. But overall experience,
really, really easy. I didn't feel the injections of the local anaesthetic. Within a few minutes, it was completely and utterly numb.
Yes.
Before I'd noticed it, you'd taken one of them off.
Yes.
So it was very, very easy.
Sure.
Very easy indeed.
Pain-wise, if you're listening to this, pain-wise, if you got moles on the periphery, it generally doesn't hurt much. But if you got moles on your face or neck, it will be slightly painful. But if you got few moles on the back is not the most sensitive area, so that will be a lot less painful, or hardly you will feel any pain. Coming back to fingers and periphery, the toes and all those things, those are very sensitive area. Genital area again is very sensitive area. Those places, if you have moles, including around the nose and or face, it will be a little bit more painful.
Okay.
Yeah. So, how would you rate us in your overall rating?
The experience was a 10 out of 10. It was really, really simple. The assessment was good. It was clear. I decided to proceed with the mole removal. Again, that was more simple than I thought it would be. It was just the easiest thing in the world. Really comfortable throughout. Tiny little sting of the anaesthetic for about half a second, and then they were off within about 10 minutes, and I went home. Really, really good.
Good.
Tiny bit of itching afterwards, which was easy to cope with.
Itching is generally a sign of healing.
And you told me that at the time, so I didn't worry too much. And then within a week or so, just disappeared. Perfect, absolutely perfect.
Good. So spot on.
Happy. Let me have some more done.
Thank you. Thank you.